to the channel. This is your fave nurse, and today I have a special guest here live on Zoom with me. Would you mind introducing yourself?
Hi everyone, my name is Jade. On Instagram, you will find me as nurse_Jade with 3 E's. Um, yeah, when you start asking questions, I'll give you all the deets on me.
Perfect, perfect. So the first question that I wanted to ask you, and you can be as detailed as possible too, is what led you to nursing? Like, what brought you to nursing, and who inspired you, and all that good stuff.
Okay, so I actually got my hands into nursing when I was around the age of 6. My mom is actually a registered nurse. She worked in home care and she would take me to work with her. And I remember it was this one patient we had saw. It just to this day I remember he was very indigent, I guess I should say. Like, he wasn't nobody was there to take care of him. He was blind. He was also a diabetic. So when we went there, I remember, and I think because of my fear of bugs or whatever, it just sticks out to me. He had like roaches and stuff crawling all over him. And I remember that day telling my mom, like, what can we do to help him? Like, how can I help this man? I don't want to leave here today and he has roaches crawling on him. Like, I want to take him home with me almost. Like, I want to help him. And ever since then, that was what I wanted to do. I originally wanted to go to medical school and be a pediatrician. But my pediatrician at the time, she was like, don't do that because you're going to be in loads of debt. She was like, you can go to school and become an FNP, a nurse practitioner, and do the same thing basically for a quarter of the debt. And that's what I ended up doing. I went to nursing school and then I ended up becoming an FNP.
There you go. There you go. I love it. It sounds like, I mean, I think with anyone too, like whenever you figure out what your calling is or what your passion is, it's one of those things. It's not like, it's one of those things that's what gets you upset.
Yes.
And it brings you closer to like figuring out what you want to do in life. Like even with nursing too, like especially with my specialty, it's like I couldn't look away from that.
Mm-hmm. Yeah.
And it kept on bothering
me at night.
Yeah, like exactly. Like it kept on bothering me, bothering me, and bothering me. I'm like, dang, like, and then I just fell into it. And ever since then, I loved it. But I completely understand where you're going from. With nursing, it's just one of those things, like you have to have a good heart. And I always tell people to.
Yeah.
Yeah, because you're caring for someone and you have to really love what you do.
And I always tell people that. You can't, I think a lot of people, one thing they associate with nurses a lot is money. And I'm like, you cannot go into nursing for the money because trust me, you will leave so quickly. You have to do this because your heart is really in it, because it's not just going to work, passing meds and leaving and collecting a paycheck. You're going to work, you're talking to family, you're talking to the patient, you're getting emotionally connected, you're moving people, you're picking them up, you're giving meds, you got to check. It's a lot. So you really got to want to do this because at the end of the day, it's really no amount of money that would be enough to pay us for what we go through. So this has to be something you really want to do and not just for the money.
I totally agree. And then kind of bringing us forward to what was your experience as, I know you're FNP, but in nursing, what was your experience like? What specialties did you dive into? What did you like? What did you not like? What did you see yourself doing? What did you saw yourself not doing?
Okay, so I have done med surg, psych, in the hospital outpatient. I have never seen myself being a bedside nurse for 20, 30, 40 years. My end goal was always to get out of the hospital and become an FNP. Now, what I will say is I got burned out really quickly in the hospital. So I really try to encourage new grads to you have to find an out. Like when I say out, you have to find a way when you leave that hospital to decompress, to let that stuff stay at the hospital. And it's really hard. Like the bedside is hard. Like I said, I remember when I was a new grad, I was out maybe off orientation. I was about 4 months out and graduated and in my job, and they started becoming short staffed. And I remember we started having to see 6 patients. And I remember one day the nurse manager said, well, we may have to go up to 7. And I was like, 7? I think that was the day I was like, oh, this is really going to become a bit too much for me. It's already a lot. And I remember about a month before I actually resigned from there, I called my mom and my dad in the car, and I was like, I can't do this no more. Like I'm crying because I'm so stressed about being here. I don't want to come here anymore. It's so much. And I'm like, it's unfortunate because it's not the job as a nurse that gets to you. It's the environment and how the hospitals treat these nurses that really gets to you. And I feel bad that that happened to me, but like I think that it's a purpose behind everything that happens, and I'm able to educate other, new grads to advocate for yourself so that this doesn't happen to you. But I ended up going to per diem at the hospital, and then I started doing psych, which I absolutely loved. I was able to, it wasn't as physically taxing and emotionally taxing. And it's different having like 12 and 13 patients in psych than it is having 6 in med surg. So it was easier for me to balance that. And with me going back to school, I needed my mental bandwidth. So I wasn't expending all of it at work. I was able to go to work, do what I had to do, go to school, and it actually all ended up working out for me. But if I had to say, I would say outpatient is better for me than bedside is, especially now with COVID. I don't think I could do bedside anymore.
Yeah, no, I agree too. I mean, I think too, a lot of people when they think of nursing, and I know we talked about it amongst ourselves, that people really think that it's just you're going to be in the hospital, you're inpatient, you're bedside, you're giving your patient meds. When nursing can be so versatile to the point where it's like there's so many options, and I don't think enough people know that. And also, just because you're fresh out of nursing school, you do not have to go through med surg.
Yes. So that was something I was going to touch on. I think that when I was coming out, when I got out of nursing school, that was something that was ingrained in my head. Like, you need a year of med surg. You need this, you need that. You don't need that. Like, if you could get right into your specialty out of school, do it, because it's med surg. That's not what you want to do, you don't need to put yourself through that stress if you don't want it. Like, if that's not what you want to do, I don't know why they push that down. Like, they put that in our minds that that's what you have to do. But there are places that will take NICU new grads. They will take new grads in maternity. They will take new grads in psych. So especially now with this pandemic, they need nurses because people are quitting or not doing stuff left and right. So definitely you don't need that year or two of med surg. Don't stress yourself out.
Yes, 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 and I totally agree. Just because, and I didn't go into I went outpatient as a new grad. You know what I mean? I didn't go into inpatient med surg. It just wasn't for me as well. So, and I always joke around with my boss because it's like, no, I got her fresh on the oven. So so she can't have any bad habits. She's like, come in here with any bad habits. I'm training her. I'm supervising her. Like, you know what I mean? As a new grad, you're just taking in anything. So, you know what I mean? You don't have, so it's really, they're training you how to be what they want, what they mold you want. Yeah, exactly. So that's why I'm like, you can just dive into it. Like, if you don't see yourself as a med surg nurse, and some people do, some people love med surg because
and to each his own. so that's why I'm like, if that's not what you want, you don't have to. And they make you think that if you don't get med surg experience, your skills won't be the same. That's not true, because that's how they trained you in med surg. They will train you in maternity. You know, like, they're going to train you regardless, and everything you do in med surg, you learned in nursing school anyway. So you don't need it necessarily to be successful as a nurse.
Yeah. And it's like, and that's just the old school nursing. They like med surg, all that stuff. Like, no, we're in 2021 now. If you want to be just a psych nurse, go into psych. If you want to be a NICU, like you said, go into NICU. There's residency programs specialized for nurses. If you want to be an esthetician, nurse aesthetic, you can go right into it. There's some spa clinics that's down the street from me that's hiring, and they put that new grads on the post. So you really don't have to go through the whole like bedside thing if you don't want to. And also too, you just have to build up a network of people.
What you know, and you just got to have the grit and the ambition to go do it. You can literally, if you wanted to come out as a new grad and say, oh, okay, well, I'm gonna just open up a home care agency, well, do that. Like, whoever you can contact to know those resources of how you can do it. You just got to know the right people, do your research, and be ready to put the work in. That's all.
I totally agree. Thank you for that, because I always tell people that, and I love when like other people like inside me, because sometimes you got to hear from somebody else to like really stick had. I'm like, you don't have to go into bedside if you don't want to. Sometimes,
Yeah.
I mean, bedside is great because, outpatient, I always tell people the difference between it's different. There's not one's better than the other because outpatient, you get emotionally attached to these patients. Like they're your patients. Anything bad happens, it's kind of like you take on that responsibility. It's like they're like literally your patient. However, inpatient, like bedside, it's more of like after I'm done,
You get a minute
that's
out.
you right
Mhm.
there. That's you. I
Yeah.
did my job. I did my 7 to 7. They survived. They're good. They're breathing. I'm out. When it comes to outpatient, it's like, dang, this person's getting admitted. Did I do something? Did I not prescribe something? All these things are in your head, and
Right.
that's the only like.
Goes back to the conversation we had before this was that it depends on who you are as a person. Like if you, because for me, I want that connection. I want to know you. I want to know how your grandkids are doing. I want to know what you're doing over the weekend. Like I want to know that stuff about you. And I just feel like bedside, I wasn't able to do that. I'm not, which is a reason why with like the route I took for an MP, I never wanted to be a CRNA or like an ICU nurse because a lot of the ICU patients are sick. I want to talk to you. I want to find out what you can't really do that. And as a CRNA, you sleep. So like, the patients are asleep, so I can't really talk to them. So that's why I'm like, it has to depend on who you are and what it is that you want because it's an opportunity for everybody in every field of like every aspect of nursing for whatever it is that you want out of it.
I totally agree. Yeah, I'm the same way. I like being nosy. I want to
Yeah,
make sure that you're in good hands. Did your sister come visit you today? How was that? Like I love the relationships that I have with my patients. So that's the benefit. Like I said, it can be exhausting, but at the same time, it's super rewarding because those are
Yep.
your patients.
Yep.
And then it can moving on to like the next questions that I had for you was like, how was NP school? So now that you are an NP, how was like the whole process? How was school? What were the challenges? How did you balance work life, school? Give us
Okay.
the.
To be completely honest with you, school was not hard until COVID hit. And it wasn't hard because of the work. It was hard because of like we didn't know the unknown of day to day. So I think that was what was stressful for me in the beginning. So I went to school full time and I was working full time. I was in the beginning, I was taking like 4 classes, which was a lot, and I was working full time. So, but it was also like those beginning classes. It wasn't like my clinical classes. So I don't want to say it was too physically or emotionally taxing because I wasn't required to be at a place often. I only had to go on campus 1 day out of the week. My campus was far, but it was 1 day out of the week, so I was able to get it done. And I'm not I'm not doing a lot of like tedious work isn't hard for me. Like I'll get it done. You know what I mean? I was doing it at work and stuff like that. So that was fine. It wasn't until the following year when COVID hit in March and I was due to start clinicals in May that I was like, oh my God. Because when we got the email in March that like clinicals would be delayed, first thing my mind was, oh, now I'm not graduating on time because we had to get 672 hours of clinical hours in order to graduate. Clinicals were shutting down. They didn't want students. Peds places didn't want students. Women's health, like nobody wanted us. We almost were like COVID ourselves. Nobody was like, don't come near us. We don't want you guys here. So we were all stressed out. Everything. And then we were all trying to navigate the new normal, how we were going to do different things. Everything went online. So then that became stressful because when we actually were able to start clinicals in July, and then some of my classmates weren't actually able to start that semester at all, which was very unfortunate. Thank God I was able to start in July. But the thing with it though was like you gotta be completely flexible. If we call you Monday, you gotta come Monday. If we say Thursday, you gotta go here, you gotta go there. So I was like, it's no way I can work full time and get this done. So I really had to like sit with myself and say, what do you want more? I knew that I wanted to get out of like bedside nursing. My whole goal was to be an FNP anyway. So I was like, okay, perfect. I'm gonna go per diem and I'm gonna go ahead and continue with clinicals. Thank God I have the support that I have to be able to, navigate my life that way. So I did that. I went per diem and then I did clinicals throughout the summer and I did it in the fall. So in the fall it got a little bit more challenging because I was going to clinical about 4 days a week. to make up for the other days. And then I remember one day, like I had sat down with my boyfriend and I was just telling him, like, I'm emotionally spun again. Like I'm not having enough mental bandwidth to deal with like so much that's going on in the world with like COVID, so much that's going on in the world with clinical, like school. I want to get school done, and I'm such a perfectionist that I'm like, I need to finish. I need to graduate with the A's I started with. Like I need to finish this the right way. So I ended up taking 2 months off. Ended up taking 2 months off from work to just like reset myself so that I can be good. I'm like, I got one semester left. I just need to, get this straightened out. And he was there to support me, which was great. So I ended up taking that time off. And then the last semester I only had one class I had to take, which was great because I felt like I was the NP at that point. It got to the point where I would go to clinicals and my preceptors would be like, here's our patients, and then they would go in the back and eat something for breakfast. And I wouldn't see them unless I needed them. But I liked it because I got to really feel like this is what I want. This is when I realized like I really like this. This makes me happy. This is what I'm striving for. So I wouldn't say FNP school is hard. What I will say is they're not on you like how they are in nursing school. You know how in undergrad they're trying to like weed out the good and the bad? It's not like that at all. Like they literally are like, do it or don't. Like they realize that everybody else is older now and they want you to, if you do the work, you do the work. If you don't, that's on you. But they're not doing anything to trick you. They're not doing anything to like weed out the good from the bad. It's really just, and it's a lot straightforward. So I always tell people when they go back to school, the nursing like material that we learned was, okay, how do we treat them as a nurse? Obviously, what are the meds we're going to give them to stop this from happening? Like, I'm gonna give you insulin because your blood sugar is high. But as an FNP, you're learning, how can I take care of this patient long term? Like, what can I do to make sure when he comes back, I can get him off of this insulin, or I can get his blood pressure down? So you learn the same stuff, you just learn how to apply it differently. So it's doable. You just got to have the patience, like I said, the grit and the desire to really, really do this and be flexible because it's going to change. I don't know if COVID going to come again. Like, I don't know. Anything can happen and you just going to have to be able to maneuver.
What is your role now as an FNP? Tell us a little bit what you do now. Because you do a
So,
lot.
so I do a lot. I'm actually, okay, so I'm an FNP, primary care FNP. So I just graduated in May. I just passed my boards in the beginning of this month, August. And then thank you. And I just got a job about a week ago doing telehealth and concierge medicine. So I'll be going to patients' houses, seeing them and treating them. And then on the other side, I also own my own med spa. So I do IV hydration, dermaplaning, like the IM injectables, like B12 shots, lipo shots, teeth whitening. I'm about to start doing Botox and fillers. So I wear my hat on that side, and then I wear my hat as an FNP. And then I also dibble and dabble in like real estate, like other entrepreneurial things. Because one thing I've learned is that my money got to come from 7 different places. I can't have it at one spot because I'm not going to depend on just one place to make sure my bills get paid. So I'll try to get myself in a whole lot of things. So I'm pretty busy.
Yeah, no, I can't even imagine life in Jade's right now. It's just like your brain must be constantly on, like tracking everything.
It is, but it's rewarding. I will say that it's really, really rewarding to be able to control you the way you want to control you. Like if I want to say like, okay, I'm going to change my schedule so that I can go to Aruba in 3 weeks, I can do that. Like if I want to say, okay, I want to take a couple months off, I can do that. Because this is like, that one job isn't stopping my money. Like, and that was what I wanted. I want to be able to have the freedom to live my life on my own terms. Like I don't want nobody telling me, oh, you got to work Christmas. No, I don't. I'm not doing that. So, that's what I want. That's what I want. Like I want my life and I don't want anybody else to have control over it. So I'm like, if I got to go through so many hoops to be able to do that, then that's what I'll do.
I totally agree. I'm like all about peace of mind too. Whatever brings you peace of mind, whatever, if you're good at something and you love something, like that is a total win. And honestly, I love the whole hydration thing. Like I'm like, wow, that's amazing. Like shoot, there's some days, especially like it's really hot in Boston, I would need some hydration therapy.
Yeah, I love it too. I love it. And it was crazy is just starting to get super popular. Like it wasn't when because I had told you before that I actually tried to start down that journey about 4 years ago, and things just weren't aligning for me until God said it was time for it to align for me. But it has become super, super popular. And I think also it's become super popular because nurses are realizing they can do this too. Like it's an easy thing to get. Well, I'm not gonna say easy. Let me pump the brakes on that. But it's not as taxing as it's a different type of hard, I guess is what I'll say. And it's not as hard physically and everything like that as bedside nursing is.
Hmm. Yeah, no, and I noticed that too. A lot of nurses, especially if people are interested in going into nursing, we don't
Hmm.
only just do nursing. We have like
Yep.
other things, like we have little investments and real estate,
Hmm.
especially real estate. Nurses
Yep.
in real estate, they don't do with that. And just because in our heads we're like, do I really got 40 more years to give to nursing?
Right. That was my thing. What's crazy is I was like, I don't know how these nurses do it that are on the floor at 65 years old because my back be hurting now. So like, I don't know how you doing it at 65. I can't do it. Mm-mm. Mm-mm.
Totally agree. I was like, like I was like talking to one of my friends the other day. I'm like, can I see myself doing 40 more years? I'm like, I don't know. I gotta work some stuff
Mhm.
around because this is just not gonna be it for me.
Yep.
But that's amazing. And then the last question I always end with individuals is, what advice would you give to individuals that are interested in FNP or just interested in nursing? Um, and vice versa, if you were to, what are some challenges that you've noticed that comes with nursing and you kind of want to tell others too, or any of those core things?
So what I will say is it's not easy. I think that a lot of people associate again nursing with money or FNP with money or psych NP with money. And we have to separate the money aspect because it's no amount of money out here that you can make that will make, if it's not what you want mentally and emotionally, it's nothing that's going to be a price tag on that. So I always encourage people to do it because that's what you want to do. Like if you genuinely in your heart want to help people and this is how you want to give back to your community or how you want to live your, then do it. But you can't say, oh, I'm gonna do it just because I like the pay. Because you're gonna get really upset. You're gonna quit that job real soon and you're gonna waste a degree, you're gonna waste money. It's not for you. And I see that pushed a lot with new grads. I see them saying, oh, I went to school because this is money or stuff like that. And then I also encourage people to know that nursing doesn't just have one avenue. It's not just bedside. You can do so much. So if you're getting burnt out in bedside, leave. Go do psych. Go do aesthetics. Go do dialysis. Like there are so many things that you can do. So don't feel like you have to go back to school just to get away from bedside because you can do so many other things with it. But I will always encourage people to know that if this is the road that you go down, it's so rewarding. It gives you so many opportunities. And if at one point I say tomorrow, I'm gonna hang this white coat up. I don't want to do no more investments. I don't want to do this again. I can always go back to bedside. That's something that you'll always have. You'll always in the nursing field, whether it be just as a registered nurse or an LPN or a CNA or an FNP, you're gonna always have a job because you're gonna always have patients. People gonna always get sick. It's gonna always be that security. So you can jump around, do what makes you happy. But when you figure out what makes you happy, go hard at it. Go hard and go full throttle at it. That's really what I would give my advice to.
I love it. I love every part of that advice. I think that's great advice for especially people, not only people that are going trying to figure out what they do, but people that are trying to go back to, like, especially I know a lot of moms too that are questioning
Mhm.
whether they could do nursing while having kids and stuff like that. It's one of those things where it can be flexible. Your mom did home care and she
Yeah,
brought you around. Like I know so many moms that do home care just because it's a flexible
it's
thing.
flexible. Yeah,
You
you're
can
not
have
stuck in
your
the hospital.
Exactly. You can have your kid and like still like I have so many people, like even my boyfriend, like he does mornings, he does like 9 a.m. to like not 9 a.m. but 6 a.m. to like 9 a.m. of home care. And he's
Yep,
got 13 patients and that's like and
and
that's
that's
just one salary.
Yep.
That's one salary right there. And he's making, you know what I mean? It's so flexible. You can be done with your day at like 9, 10 a.m. See,
Exactly. That's what I'm telling people. But that's the thing. People they have to take back their independence. We can't tell them to go do it. When you wake up one morning and that back start hurting, you got to go put them scrubs on. And you realize, look, I'm sick of this. Then you'll be like, all right, I'm gonna figure out what I have to do to get back my independence. That's why I said, like, I did that med surge bedside thing because that's what I was told that you needed to do for 8 months, and then I was like, nope. This is not going to be it for me. I'm not going to be cracking and my back hurting like that young. I'm not going to do it. Mm-mm.
no, I totally agree. But I just wanted to say thank you for coming. Thank you for talking about your experience because I know so many people that are interested, and I'm sure that you've inspired and you've led so many people to go down the same path as you. Thank you for everyone that's watching. But any last remarks that you wanted to just touch up on?
So what I will say is that I am a very open book. If you guys would like to DM me and ask me questions, I'm here. I may not get back to you as soon as you write me because sometimes I forget that I have DMs, but I will always write you back. If you have to write me again, do that, and then I will respond to you. You can find me on Instagram at, I don't know if I said it in the beginning, but at nurse_Jade with 3 E's. And then I do plan on starting a YouTube channel in September. So that way, like all of the questions, I get a lot of questions you guys can just see on the YouTube channel. But just follow me and check for updates. And I wish everybody much success in the nursing field. Whatever road you're going down, whatever route you're taking, you got it. And I know that everybody, religion is different, but whoever your higher power is, put your trust in him and you go for it.
Thank you. That was so great. Thank you for watching, guys. Please like, subscribe. Jade's Instagram will also be in the description box if you want to reach out to her and ask her some FNP questions, NP questions, entrepreneur questions, any type of questions you would like to ask her. Like I said again, thank you for coming, Jade. It was a pleasure. Bye,
Thank you.
everyone. Bye.
Bye.